Welcome back and thank you for staying with Checkpoint. Let's continue informing you. And of course, today's focus is centered on World AIDS Day, which Kenya is commemorating today. Now get this, Kenya has made significant strides in reducing the impact of HIV and AIDS over the past decade.
However, despite an 83% reduction in new HIV infections across all populations, the fight against AIDS is far from over.
Alarmingly, over 20,000 people living with HIV succumbed to the disease in 2023 alone.
As Gloria Milimu reports, nearly half of these deaths occurred among men, raising critical questions about why so many lives are still being lost despite the numerous interventions in place. Take a look.
Kenya is home to over 1 million people living with HIV. And Calvin Njoroge from Nairobi's Feather Estate is the poster child of the burden of the disease among the country's youngest population, who bear the brunt of new HIV infections cumulatively.
We also hold social media.
Diagnosed with HIV in 2016, Njoroge describes the emotional toll of navigating his diagnosis.
The first time I got tested is also the first time I turned seroconverted. It was a bit crazy. It was a bit hectic for me. I didn't tell anyone for like a period of 3 months. Yeah, I was struggling with my medication for like 3 months. Also acceptance.
Despite a decline in new HIV infections in the country, adolescents and young adults between the age of 15 and 34 years, just like Njoroge, contributed to 73% of all new adult HIV infections in 2023. Experts warn that this trend threatens to reverse the gains made in combating the epidemic, particularly as this group lags behind in treatment adherence.
If I got this information before I went and engaged in my first sex encounter, maybe things would have been different. And us not talking about it in schools or talking about sex with our children, they still go and explore.
This is also the group where you find that this newfound freedom of partying, of going out with friends, and then they are not taking care of their health and their sexual health. And that's the reason why we are finding that this age group, there are new HIV infections. There's a higher rate of new HIV infections among them.
What's even more worrying is that the progress in reducing AIDS-related deaths among adolescents and young adults has been slow.
So there are those who may opt not to take treatment at all. And with no treatment, then it means they are not able to control the viral load levels. So that then may lead to HIV translating to AIDS and therefore the deaths that are there.
While men like James Okombo from Kayole in Nairobi County account for 35% of all people living with HIV in Kenya, close to half of all AIDS-related deaths are said to have occurred among men.
This is attributed to health-seeking behavior among men, not seeking treatment, the issues about adherence to treatment and acceptance levels.
Whereas the number of people living with HIV on antiretroviral therapy has increased twofold in the last decade, thousands are still dying. In 2023, Kenya recorded at least 20,480 AIDS-related deaths.
So much so that an estimated 61% of AIDS-related deaths among adult men in Kenya occurred among those aged between 35 and 54 years in 2023.
For HIV, the issue of one's immunity comes in. Because if your immunity is low, then if you get any other disease, for instance, you get tuberculosis, you get pneumonia, then it will put you down. With ARVs, it ensures that the virus levels are low and your immunity is high.
However, Okombo, who was diagnosed with HIV in 1998 and has had his fair share of stigma due to the diagnosis, is on a mission to help prevent these deaths among people living with HIV, especially his fellow clergymen.
Tell our people to go and know their status.
He came up with an initiative dubbed Gospel Parliament that brings together people from different walks of faith to discuss about the HIV epidemic and how they can stop it in its tracks from disrupting lives.
Through Gospel Parliament, we have been able to reach up to close to 1,000 pastors, but we have up to 200 who have a reality in life today. Personally, I have 36 who knew their status through our program, and today they are taking their ARVs.
Experts reckon that Kenya must address the HIV burden among its boys and men in a bid to realize the UNAIDS 95-95-95 targets on testing, treatment, and viral suppression, considering that the population is yet to reach the 95% target, despite those initiating antiretroviral therapy treatment having increased from 81% in 2020 to 90% in 2023. Additionally, addressing factors contributing to treatment interruption that remains high among men compared to their female counterparts is advised. At least 41,028 people actively on ARVs interrupted treatment in 2023. Gloria Milimu, KTN.
Well, it's clear as per that report by